Guys, welcome back to Medical Coding with Blue. Today's episode is all about, do you need the CPC and the CPB to be successful in the health information field? If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, disclaimer first. I have been a veteran medical coder since 2008. I became a medical coding student in 2007. I have seen a lot of things in this industry. I am well versed with the things that go on in this industry and the medical coding credentials. I have been through it all, okay? I am currently certified with the American Health Information Management Association. On my channel, I have always strongly recommended that you, if you are looking to be a medical coder, that you be certified either through the American Health Information Management Association or the American Academy of Professional Coders. Both of these are well-respected organizations in the health information field. Now, AAPC, they do like their specialty credentials, and they do offer a package that has the student to learn the CPC plus the CPB, and they also have a CPC by itself. You know, you can learn it by itself. And they also have the CPB by itself. All right, so I'm going to read this comment and then we're going to get into it. But I will say this. My opinions here today are my opinions. No one, this is not an ad for either association, for AHIMA or AAPC. These are all my opinions. These are the things that I have seen. And for me, when I see what I feel is an injustice, as far as like, you know, these credentials and things like that, people not understanding the purpose of these credentials, what they are for, and when you should get these, I want to speak up about this today. So I'm going to read the comment and then we're going to get into it. So here we go. So the comment reads, thank you for your honest advice. There are educational platforms that say to people that you must be certified with both CPC and CPB to succeed in this industry. But since the pandemic, even remote data entry jobs that are medical affiliated just want knowledge and not so much the certifications. Can you do the job, maybe with a little training? Thanks again. This was helpful. All right, so here's the deal. If you want to be a medical biller and you are looking at the medical billing positions, right, in the job listings, they are going to ask either for experience or they will tell you that no experience is needed and that they will train you. Or if you have some transferable skills, you know, maybe you did billing, but not maybe medical billing, but you did some other kind of billing, that's a transferable skill that they are fine to take you on. They are often not looking for these people to be certified, okay? They don't even have to be a certified medical coder. They don't have to be a certified medical biller. They can just walk in off the street and say, hey, I want to apply for this job. And, you know, if they have a good resume or if, you know, they talk with the employer, you know, they'll have a good chance to get an interview. So that's something that you got to know right out of the gate. There have been people who have been able to find medical coding jobs without being certified, okay? But the employer is usually asking for them to be certified within a certain amount of time. So if you've gone through a program that makes you look good, or if you've done your independent study and you're about to sit for your exam, you can always let them know that as well. But I want to highlight something that the viewer said here. The viewer said, there are educational platforms that say to people that you must be certified with both CPC and CPB to succeed in this industry. This is not true. And do you know how I know it's not true? Because when you look at the job listings, I have never once seen a job listing say that the candidate either must have multiple credentials to get this job or that the candidate must have the CPC and the CPB. I have never seen that. And I rarely see them ask for the CPB. So the one that they're always asking for of the two is that CPC. The CPC covers reimbursement on the exam. The CPB is just an expanded format of questions, basically, this exam is, because there's only so many questions that the CPC covers for reimbursement. It is just mostly the breakdown of the CPT book and the different sections that, are covered in there. So that's something that you have to know, all right? Don't be taken just because somebody says in an educational platform that you need both of these to succeed in this industry. No, ma'am, no, sir. What you need to succeed in this industry is knowledge. You need to know your medical terminology, your anatomy, and your pathophysiology. And believe it or not, this is where a lot of new medical coders are suffering because they don't know this stuff, or they don't think it's that important. Or sometimes I have heard that their instructors say, oh, you'll learn it on the job. Don't worry about it. Just learn how to pass the test, and then you'll be able to get your job. This is why new medical coders have a hard time getting in, because of these fast-paced medical coding programs and not knowing the information, not knowing how to look codes up appropriately in the book. Because the real world is not multiple choice, folks. It is not multiple choice. There's not going to be a list of possible codes that you can choose from. You have to be able to abstract, which means to look at and comprehend the documentation, take out the appropriate diagnosis and the appropriate procedures, and be able to code those. That's what abstracting means. You're looking, you're getting, you're gathering, and you're entering them into the claim. So even though you may run across like a op note that has the title of the procedure, you cannot just code by the title of the procedure and their final diagnosis. You have to make sure that the documentation supports the final diagnosis, that it supports the procedure that was performed. If it doesn't, then you need to pick up the appropriate and applicable diagnoses and procedure, or you need to make, a query, whatever the case may be. But I want you guys to know that when it comes to these additional credentials, it hurts me to see brand new medical coders who have no idea what they're doing rack up a whole line of credentials because somebody told them on an educational platform that they need this to succeed. Oh, that if you only have one credential, employers won't want to hire you, but they'll want to hire somebody with a bunch of credentials. No. An employer, let's take the rosy glasses off, okay? I'm trying to sell a program, right? Glasses, take those off. Let's look at the reality of the situation. When you look at the job listings, they're always asking for the candidates to be certified with one certification, that they want you to be certified with AHIMA or AAPC. And of course, they're going to say that they want the person to have experience, because who wants to train somebody brand new? And then, heaven forbid, that they've been in a fast-paced medical coding program where they didn't learn anything, or the instructor didn't teach them appropriately, and now the employer has to be stuck with that responsibility. So think about this now. We're thinking about business, right? So these employers are out there having to train new people who should have already been trained coming in the door, right? And they have to be the one to train them. And now what is that new medical coder going to do? Get their training and either stay or go, depending, on what the deal is and what's going on. So employers are not really about that. They want the person to come in with experience and knowledge. So if you don't have experience, at least come in with knowledge. Because if they're willing to give you a assessment test, they want to see where you're at. If you can pass that assessment test, then you are one step closer to getting that job. If you can't, then you just confirmed the employer's fear of, well, this person doesn't know and they're too green and they need to keep studying and learn so that way that when they can come back and get a job with us later on. So that's something you got to keep in mind. It's not personal, it's business. And so my channel is about making sure that you all are prepared. Now, I get a lot of screaming and hollering, either in the comments or through email, telling me, well, Blue, no, I can't this, I can't that, I don't know this, I don't know that, my teacher this, my teacher that. At the end of the day, the schools already have your money. So if they're not teaching you, then you need to grab the bull by the horns and you need to start finding a tutor or find a mentor that can help you. There's a ton of tutors on LinkedIn. I'm a tutor myself. My rate is in the description box below if you're interested. And sometimes that's all you need. You just need somebody to explain it to you. There are plenty of resources out there, but no one is going to spoon feed you this information. I have a ton of videos on my channel about different tips and what channels I recommend as far as like learning anatomy and physiology and things like that. All the books that I recommend, and I will still get those questions. Well, what books do you recommend? Where can I go and learn? And the CEU question I get every time. I have 6 videos on my channel solely about CEUs and how many there are and things like that. And like I said, last week I did a whole series on explaining why I like the Optum books and the AMA CPT Professional Edition. I did a whole thing on that. There's not a lot of views on those videos. So, I mean, come on guys. Just take a look through the videos and you'll start stumbling on all the videos that are answering the questions that you all are asking, okay? So, please don't be taken advantage of with these multiple credentials. I have talked about the CPB before. I have talked about many of these other accessory credentials, if you will, because again, they're just expanded versions of what you're already tested on with the CPC. So all you need is one. And I always recommend to my brand new medical coders that you start your career with just one certification. It is, if you are with AAPC, it is 36 continuing education units for one certification. And that number goes up every single credential that you add on. Oh yes, they are going to get their money. Not only that, AAPC does require you to be a member every single year. So in addition to having multiple credentials now that you have to get multiple CEUs for, you still have to maintain your membership every single year. All right? AHIMA does not require any of those things. They do require 20 CEUs, but they do not require you to be a member every single year. They do have different prices for when you are submitting your continuing education units. You do have to pay a fee if you are not a member. And it is a different charge because with the membership fees, it's different with AHIMA. So that's something that you really have to consider when you are getting into this field. It does not require you to spend all this money. Stop spending money so freely with getting all of these things because somebody's telling you, oh yes, you need them. I'm telling you, no, you don't. Because all you need is the one certification. But if you want to try to get a job out there and you don't have any experience and they're willing to give you a try, by all means, then you just got really lucky, because it is very difficult to find a job with a certification, let alone not being certified. But if you are looking to get into billing, and perhaps you've done billing before with just a different type, not medical, but just a different type of billing, you know, that's a transferable skill. And a lot of times I have seen on these billing job listings that they do want the people, that they'll say, well, we'll train, because not everybody uses the same insurance either. Some places are going to use only certain insurances, and some are going to be, you know, just, we only use this insurance, or we only do this kind of billing and that kind of thing. So that's why a lot of employers with billing are willing to train. So that's just something that you can consider and think about if you are wanting to get into this field, but you don't know yet, you know, something that you can think of and put yourself out there and see if you can get a job without having a certification, you know, when it comes to billing. But when it comes to the coding, you do want to get a certification, because employers will start to take you more seriously if you do know. And once you start getting in there and you start learning all these things, and if you want to branch out and get additional credentials, please make sure that you understand what you're additionally tacking on, and that it doesn't somehow overlap with what you already have, right? Because that's important. You don't want to keep duplicating credentials that are kind of saying the same thing but just broken up, right? And so you don't have to be certified with both associations. That's another misconception too, is that, oh, I want to be certified with both. You just need to be certified through one, okay? AHIMA or AAPC. Now, some people will get their degree, and AHIMA is the only one who offers the degree designations. but the individual maybe didn't feel comfortable with taking a AHIMA medical coding certification, so they wanted to go with AAPC. That is totally fine. But just know this, that you will have to have your AAPC membership dues every single year, and you'll have to come up with those continuing education units for them too as well, and it is more. Okay, so that's something that you all have to know. All right, so but I hope that this covers this question. You don't need both to be successful. What you need to be successful as a medical coder is knowledge. Study and continue to study, even when you have passed your certification exam, because a lot of people will tell me, well, Blue, I feel like I was only taught how to pass a certification exam. So if you feel this way, then you need to proactively work on the workbooks that I recommended, again, in the description box below. Please do not ask me, because they are there. The title is there, the links are there, you don't have to click on the links. And yes, they are from 2019, but get this, the books from 2019, the workbooks, are literally asking the same questions as the current year books. And because they are asking the same questions, a lot of the answers from the 2019 book are still relevant. There are going to be some that are going to be updated because the code range updated, but you'll be able to tell, especially if you can't find that code from the answer key in your current book, then you'll be able to know, okay, this is an updated code. Let me see what it updated to. So that's always a possibility that you can do that. And it's just saving you a little bit of money, because there's a huge difference between paying $30 versus paying $152, right? For any of these books. I mean, they just go up in price, especially if it's the current year book. But if you want to get the current year book, hey, it's up to you. I'm just trying to save y'all some money because you're still learning the same thing anyway. Okay, so that's just my advice when it comes to that. There are so many things out there that just are not true when it comes to what employers are really looking for. Employers want you to be polished. They want you to look good on paper, so that when they meet you and they decide to give you an assessment test, that you are ready and that you're going to go in there confident. And even if you tell me, well, Blue, I've never done this before. Do you think I did this before? When I walked into my first assignment, I went to the temporary agency, and then I got signed on with them, and they were the one who gave me 2 long-term or 2 lengthy assignments. The first one was for 90 days. And you know, when you sign up with a temp agency, because I always recommend you guys sign up with the temp agency. When you sign up with the temp agency, and it's for medical professionals in your area, you can Google it, guys. Please Google it. Do not ask me which one I recommend. Every place is different. So Google in your area temporary agencies for medical professionals, and then it'll tell you. They're looking oftentimes for medical billers and medical coders, and it's going to be like for assignments that are for a few weeks, maybe even a few months, because they don't call in for medical coders or medical billers for only one day. Okay, it's not like Manpower. All right, a lot of people get confused with this, thinking that I'm telling them to go to Manpower. It's not Manpower. It's when you're going on these assignments. This is just to get you some practice. All the places that you're getting assigned to, you can add those to your resume, and that's experience that you'll have, and you'll be making connections in the real world. Okay, it is worth it. Again, I got 2 positions, and it led me to my forever home with coding, which is where I am now. So that's something that you all should consider, applying with a temp agency. And even if you're not finished with school yet, you can still get yourself registered, because this is another person that is going to be out there actively looking for a job for you. Think about that, right? Now, if they're out there looking for a job for you, now you got not just yourself, but you have another person, because it is their business to get you a job. Because if you are working, then they're making money. And that's the whole thing. But again, be prepared. Continue to work on your workbooks, and continue to read over your coding guidelines. You got to know those coding guidelines, folks, because there's a lot of brand new medical coders that don't know them. This is why I make it a point all the time. And I know, Blue, I get it. No. We need to say this. Read your coding guidelines once per week. Do not tell me that you can't do it, because yes, you can. There are people who have families and kids who do it all the time. They make the time. And if it is important to you, you will make the time. I'm just saying. So, I'm going to wrap this one up. Best of luck to you. If you're out there and you're brand new and you are getting your certification, start with 1. Wait 2 years. Then decide to go on if you are going to get all these other credentials. But make sure that you are deciding wisely what you want to do, and not just because you want a whole alphabet after your name. An alphabet after your name is not impressive if you don't know what you're doing. I'm just saying. So, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, like, subscribe, and share. And I will see y'all next time. Bye.